I'd now like to invite Faylisha Scott, who's Projects and Fundraising Officer at the Motherhood Group. And Faylisha's going to be sharing how their work to support Black mothers has been boosted by the National Conference. Thank you. Welcome, Faylisha.
Thank you. Imagine lying in a hospital bed, clutching your stomach in pain, and being told to go home, not once, but 5 times. Imagine your labour intensifying, but the epidural you're promised is delayed, or even worse, it never comes. Imagine crying out only to be told your pain doesn't match what the monitor is picking up. Imagine hours are passing. The professionals around you are brushing off your concerns. You're scared, you're in pain, and you're being dismissed again. Now imagine feeling your baby's movements slow. No one's listening, no further checks, no escalation, no urgency. And finally, imagine giving birth and discovering your baby was in distress the whole time, suffering from delayed growth that should have been identified. This is a story of a woman called Sandra Igwe, a woman I have the honour of working with. She went on to found the Motherhood Group, a national organisation committed to transforming the Black maternal experience in the UK. Good afternoon, everyone. My name is Faylisha, and I'm the project manager at the Motherhood Group. Over the past few years, I've seen firsthand that Sandra's story is not an exception, it's part of a pattern, one echoed in the stories of thousands of women we've engaged with. Black women in the UK are 3.7 times more likely to die in childbirth compared to white women. And while that number gets repeated often, behind it are real mothers, real children, real families that are left to pick up the pieces. But trauma doesn't end with survival. Black mothers are also more likely to experience postnatal depression, birth trauma, delays in receiving pain relief or emergency care, feelings of being isolated, silenced, or dismissed. This is not anecdotal. It is a systematic issue and it demands systematic change. The Motherhood Group was created to centre the voices of Black mothers and close the gaps in care and support and representation. We deliver CPD accredited training for healthcare professionals on cultural competency, unconscious bias, and institutional racism, reaching over 7,000 practitioners so far. Free counselling and access to legal clinics and dual services, ensuring culturally safe wraparound support. Peer support programs, events, local gatherings, creating safe, connecting spaces and visibility. Are you a Black mom? Well, our Black Mums app is groundbreaking. AI-powered and a community hub offering therapeutic content, peer support, and practical resources for Black mothers. The annual Black Maternal Health Week offers daily webinars, panel discussions, and digital campaigns to raise awareness and mobilise change. Our ongoing government partnerships and strategic commissions make sure lived experience sits at the centre of national health policy. Our Black Maternal Health Awards spotlights the researchers, clinicians, and community leaders and organisations pushing for better outcomes. We do this because no one understands the needs of Black mothers like Black mothers themselves. Our work is rooted in the community, but its impact is national. One of our flagship initiatives is our Black Maternal Health Conference, the UK's largest CPD accredited event focused on Black maternal health. This isn't just a one-off event, it's an ongoing movement embedded within the Motherhood Group's wider work. Since launching, we've hosted 3 powerful conferences, with our next one in partnership with national partners already in the planning. Past speakers have included high-profile figures such as Diane Abbott, Florence Asholomi, Belle Roberto Adi, Chief Midwifery Officer for England, Kate Bridworth, and Kelechi Okafor, national policy advocates, NHS trust leaders, and powerful mother advocates. Each conference centres Black mothers' lived experience, whether navigating baby loss, NICU journeys, sickle cell complications, or maternity trauma, and moves beyond awareness into action and accountability. Through our CPD training strand, we also support the professional development of healthcare workers, ensuring those who serve Black women are educated in culturally relevant, community-informed care. Every event is more than just attendance. It's about trust building, truth telling, and policy influence. This is a living, breathing platform of change, growing in impact and influence year on year. This is a problem for Black women to fix alone. It's a health crisis, a justice issue, a human rights concern. So the question is not how can we change the system? The question is, will you help us do it? Whether you're a policymaker, healthcare leader, a funder or researcher, or someone who simply believes in equity, you have a role to play. If you're a Black mother, please know this: you are not alone. If you want to be part of the solution, then join us. You can download the Black Mums app to access support and content and connect with the community. You can sign up to our newsletter to hear about events, policy work, and campaigns. You can visit our website, themotherhoodgroup.org or blackmums.com. You can collaborate with us on strategic commissions, research, or local partnerships. Reach out if you're a funder. We're committed to partnerships that amplify our work and drive down maternal health disparities on a national level. If it matters to you, then please get in touch. Everyone has a part to play in Black maternal health. What will yours be? Thank you.